Today we're going to continue our lecture on drug calculations for pediatrics, and our focus today will be on how to calculate drug dose using the body surface area. If you can remember, in our last lecture, we calculated how to solve or calculate drug dose using the weight-based rules. And I said for the weight-based rules, we have three rules or formulas. Now, the first formula we made mention of was the Clark's rule. The Clark's rule. Then we also made mention of the hamburger's rule. So today we're going to calculate using the body surface area. There's a formula that has connection with the body surface area. So these are the three weight-based rules, meaning these are the formulas or rules that have connection with the weight of the child or the weight of a pediatric patient. Now, the Clark's rule focuses on the weight of the child in pounds. We have already solved some examples on that aspect, so you can look at the video, watch out for videos on that. It has been posted on the channel. Also, we have discussed also the hamburger's rule, how you can use the hamburger's rule to calculate the dose of a drug. Also, that has been done previously, and this aspect of the calculation focuses on the weight of the child in kilograms, while the Clark's rule focuses on the weight of the child in pounds. Then lastly is the body surface area, how to use the body surface area of a patient, of a pediatric patient, to calculate the dose that will be suitable for that child. But of course, this more or less, this particular one is an extension to these tools. Extension meaning, in addition to weight of the child, we also take into consideration the height of the patient. We also need the height of the patient for us to be able to calculate the body surface area. Now, so what is the formula? Quickly, let's look at the formula that we can use to calculate the drug dose for a child using the body surface area of that child. Now, this is the formula. It says that dose, that is the dose of the drug that you want to administer, is given to the body surface area, that is BSA, of the child. Body surface area of the child multiplied by the adult dose over 1.7. So this is the rule or the formula you can use to calculate the dose of a drug to administer to a child using the body surface area of the child. Now, if you look at this formula, we have a term that has been occurring severally, that we have seen or that has appeared severally in all of the rules or formulas that we have calculated drug dose. Now, the adult dose seems to be appearing every time. That is to tell us how important the adult dose is with regards to pediatric dose calculation. So that is, before you can calculate any dose of a drug for a pediatric or for a child, it's very, very essential that you also have or know the adult dose of that drug. If you don't have the adult dose, it will be very, very difficult for you to get the dose for a pediatric patient or for a child. So this is very, very essential. It's an essential part of the topic. Now, if you look at this particular formula, it says body surface area of the child multiplied by the adult dose over 1.7. 1.7 here is the average adult body surface area. That is 1.7. So this is the formula that we are going to be using to calculate the dose of a drug that has link to body surface area. But please take note. We have said previously that the weight-based rule seems to be the universally acceptable rules. Yes, we don't have any discrepancies or counter arguments or acceptability of the weight-based rules. No, every healthcare professional who is charged with the responsibility of administering drug, of course, they all accept the weight-based rules. So the weight-based rules seems to be universally acceptable. No argument with regards to how accurate the doses that are calculated using the weight-based rule are. They are very, very accurate and correct. In fact, in terms of suitability and accuracy, they are the best without any doubt, without a doubt. So now, why are they accurate is the patient's weight is taken into cognizance, meaning if I am a 5-year-old child, just as we have made a reference to weight age previously, where we said we can have two 5-year-old children. One is looking light and the other one is looking floppy or having a heavy weight, and you are giving them the same dose based on the age. Of course, it must result in so many issues. One can be underdosed based on his weight. The other can be overdosed based on his own weight. But of course, since we are using age as a criteria for calculating the dose, you will have to give what you got. And that is why a lot of scholars are against the age-based rules. But in the case of the weight-based, every child will get what is um, specific, so to say, or what befits his own weight, and that is very, very important. Very, very important. So quickly, let's quickly look at how to calculate those using this. But the first thing we need to take note of is this. If you look at the two formulas that has connection with weight, it was much, much easier because once you weigh the child, you can take whatever value you have and you put it into the formulas that we have established previously and you get your calculation. But in this case, we have a problem, and that problem is the body surface area, meaning you will have to calculate the body surface area of that child before you can input it into this formula to calculate your dose. So how do we go about it? So that will take us to the next part or the next phase in this calculation. So that is to say, how do we determine the body surface area? Now, body surface area can be determined using an equation that we call the Monstellar equation. Monstellar equation. Monstellar equation. Although the equations are two, let me put it like this: equations. Monstellar equations. We have two Monstellar equations, and these equations can be used to calculate the body surface area of a patient. These equations are not limited to children alone, meaning you can also use the Monstellar equations to calculate the body surface area of an adult. Now, sometimes some drugs are dosed using the body surface area of the patient, especially most of the cancer drugs. So before you can administer those drugs, you need to get the body surface area of the patient. And how do you go about it? You can use the Monstellar equation to calculate the body surface area of that patient. So this is not limited to children alone. It can be used for pediatric patients and likewise for adult patients. Now, what is the Monstellar equation? The Monstellar equations are two, as I've said earlier. Let's take the first Monstellar equation. That is to say, the body surface area of a patient, the body surface area of a patient can be calculated using the first Monstellar equation that says BSA is given to be height of the patient in centimeter. So the height is going to be in centimeter multiplied by the weight of the patient. The weight of the patient is going to be in kilogram over 3,600. So this is the first Monstellar equation. So the body surface area of the patient, whether an adult patient or a pediatric patient, can be calculated using the height of the patient in centimeter multiplied by the weight in kilogram over 3,600. This is the first Monstellar equation. Now, this particular equation suits our setting because the units that are available here are units for most of our instruments. Yes, our weight is usually calibrated in kg, and of course it gives units or values in kg. So this suits our setting. Our heights are usually measured in centimeters with few exceptions where we have them in meters. But of course, majorly they are in centimeters. Then of course the denominator, which is 3,600. So this is the best equation. The first equation of Monstella suits our own environment or our setting here, where we don't need to go through the stress of converting from one unit to another. So now, the second Monstella equation, of course, all of this is squared. You can see height in centimeter, multiplied by weight in kilogram over 306,600, all squared. So this is the Monstella equation number one. Then the second Monstella equation also take into cognizance what we have just mentioned. That is to say, the height of the patient is taken into consideration, but this time around the height is in inches. The height is in inches and the weight is in pounds. The weight of the patient is in pounds. Then the denominator here is 31 as which is quite different from what we have for the first Monstella equation, where we have 3,600 as the denominator. All of this is still squared. So this is the second Monstella equation. Though this is the second one. So Monstella equation number 2. So the height here is in inches, the weight is in pounds, and of course the denominator is 31. So you can see the differences. The difference is more is much. It's much in the sense that if I want to apply my parameters that I've obtained using our own local instruments here that are the results are obtained either in kilogram or centimeter, I have to do an extra work. Extra work in the sense that if I weigh my patient in kilogram, for me to utilize the second Monstella equation, I have to convert that kg that I've obtained using my instrument, I have to convert it into pounds. I have to also convert my height that I've obtained in centimeter into inches. That will add some extra burden, so to say, on me. But it's still very possible because we have a conversion factor, we have a connection or relationship between kilogram and pound. We have already established that previously. Likewise, we have a connection, meaning I can change kilogram to pounds comfortably. I can also change centimeter to inches comfortably without any issues. But of course, it will be a very long process, right? Converting to be a very long process. So to avoid all of the conversions, we're going to use what suits our own setting here. So our setting here is our heights are usually measured in centimeter and our weight is always in kilogram, and our 3,600 all squared. So this is the first Monstella equation. So this is what we are going to be using for our calculations. Now, let's take an example to illustrate better so that we can have a sound understanding of how to apply the patient's information to calculate each of our body surface area. Now, if you are using the reference material that we have been using from time, which is still the calculations in pharmacology for nurses, is one of the books I authored, and it's what we have been using as a reference material. So let's take this example so that we'll solve it together for us to have a better understanding. Now, the question reads, calculate the body surface area of a patient whose weight. So we have been given the weight of the patient to be, whose weight is 70 kg. So the weight of the patient has been given to be 70 kg, and the height of the patient, height is given in centimeter and it's 167 centimeters. So this is the question. The question reads, calculate the body surface area of a patient whose height is 167 centimeters and weigh 70 kilograms. So this is the question. Now, if we use this information, we can easily calculate our body surface area. Now, if you look at the question, this information seems to be an adult information. Of course, you can't have a child that weighs 70. it's very not possible. This is typical of an adult weight and height. Now, if you substitute what we have got from the equation, it will be much easier for us to get the body surface area of that patient. Now, from here, body surface area will be, the height of the patient was given to be 167 centimeters, multiplied by the weight that was given to be 70, which is the average adult weight in kg, over what? 3,600. All of this is squared. All of this is squared. So this is, we have substituted our information into the equation. So 167 is the height in centimeters that was obtained from the equation. Then 70 is the weight that was given in the equation. And of course, the denominator remains, all of this is squared. So this will give us 11,690 over 3,600. All of this is still squared. All of this is still squared. So this will give us 11,690 over 3,600 will give us 3.2472. All of this is still squared. So this is what we have, 3.2472 all squared. Now, for us to get the body surface area, we have to find the square root of 3.2472. So whatever we have as the square root will definitely be the body surface area of the patient whose weight is 70 kg and height is 167. So this is what we have, 3.247. So let's bring it here, 3.2472, of course, the square root. So let's look out for the square root of this. Now the square root of this will give us 1.8. Of course, it has some figures like that, but let's take it to be 1.8 squared. So 1.8 squared is our body surface area, and this is the body surface area for a patient whose weight is 70 kg and the height is 167. So this is how to calculate body surface area using the first Monstella equation. So let's take an example. Let's take an example where we can apply this formula to calculate the dose of a drug for a patient. Now let's take an example. Let's take an example. I'll read it so that we can have the example. Now, example 1. What dose of gentamicin injection? So the injection that we're going to be considering here is gentamicin. It's an antibacterial agent or antibiotics, and of course, it's one of the very good antibiotics that can be applied or used on children as well. So, what dose of gentamicin injection will you give to a child whose height is 60 centimeters? So, let's take down the information. The height of the patient has been given to be 60 centimeters. What dose of gentamicin injection will you give to a child whose height is 60 centimeters and weighs 15 kg? So weight of the patient is also given to be 15 kg. Now, full stop. Let me take it again so that we can get it. What dose of gentamicin injection will you give to a child whose weight is 15 kg and height is 60 centimeters? Full stop. Given that adult dose of gentamicin is 80 milligrams. So the adult dose for our drug, which is gentamicin, is 80 milligrams. So this is all of the information that we need to calculate the dose of gentamicin that should be administered to this child. Now, let's take this up. Now, first, before we can apply this formula, we have the adult dose already. We have the average adult body surface area. But one thing we don't have yet is the body surface area of the child. And how do we go about it? We have to first of all calculate the body surface area so that we can apply this formula. So how do we go about it? The first thing we need to do is use any of the Monstella equations. Anyone can go. But in order to reduce the burden or stress on ourselves, it's best we use the first Monsteller equation. Why? Because our height has been given to us in centimeters, which is 6 centimeters, and the weight of the patient also is given to us in what? In kg, that is 15 kilograms. So it will be much easier for us to apply the first Monsteller equation. So what is the equation? The equation reads or says body surface area, this time around, of the child is what? The height of the child, which of course must be in centimeter, multiplied by weight of the child, still in what? In kilogram, over 3,600 all squared. So this is the formula you can remember. Now, height of the patient has been given to us to be 60 centimeter. The weight has been given to be 15 kilograms, and of course our denominator 3,600 all squared. So this is, we have substituted into the first Monsteller equation. So let's continue with the calculation. Now 60 multiplied by 15, 60 multiplied by 15 will give us 900 over 3,600 all squared. So this will give us 0.25. So this will give us 0.25. But of course, still square. That is 900 divided by 3,600 will give us 0.25. Of course, our square root still continues until we are done with it. Now, let's quickly take the square root of 0.25. So this will give us, square root of 0.25 will give us 0.5. But take note that body surface area is given in meter square. So this will give us 0.25 all squared. From here, 900 divided by 3,600 will give us 0.25 all squared. So at the end of it all, if you take the square root of 0.25, you will get 0.5, and the unit for body surface area is meter squared. So this is the body surface area for a patient whose height is 60 centimeters, weight is 15 centimeters, and of course, using the first Monsteller equation, we're able to obtain 0.5 meters square as the body surface area of this child. So this is the first part of the calculation. It's the first part of the calculation. Now, if you look at the formula we have written earlier, which says body surface area of the child, which is what we just calculated, multiplied by the adult dose that was given to us, you remember from the equation, over 1.7, which is the average adult body surface area. So we are done with this part of the formula. That is, we have utilized the Monsteller equation to calculate our body surface area. So right now we are going to substitute what we have calculated as our body surface area into this equation to get the dose we are going to administer. So this will give us 0.5 is what we calculated as the body surface area for the child, multiplied by adult dose was given in the equation as 80 milligram over 1.7. So this is the substitution. We have substituted correctly into the formula for calculating drug dose. Now, this will give us 40 over 1.7. So at the end of it all, we have 23.5 milligram. 23.5 milligram. So the dose of gentamicin injection that you are going to give to a child whose body surface area is 0.5 meters square is going to be 23.5 milligram. So very simple and direct. Very simple and direct. Now, you can end it this way, but you can still go further. Yes, you can still go further. I think I've done a video on that already, how to change or convert your dose in milligrams to mils. Now, since the drug in question is an injection, there is need for us to get the equivalent of this 23.5 milligram in mils, because if I should give you the ampoule of gentamicin For you to bring out these dose in mils, it will be difficult for us. It will be difficult for you to even do. But of course, we can get the equivalence of this particular 23.5 milligram in mils. We have done that. You can go back to some of the previous, one of the previous videos that we have. So we have done how to calculate drug dose, specifically injection. So let's quickly do that so that we can bring out the drug in mils, and of course we are going to withdraw it. Now we are done with this part. So let's quickly look at this, the third phase now, because the first phase was where we calculated the body surface area. The second phase is where we calculated the drug, that is the dose that we are going to administer. And the third phase now is where we are going to get the equivalent of what we just calculated in mils. So now how do we go about it? Now the dose of the drug can be calculated using what we require, a formula we call the required strength. We use the required strength over the stock strength multiplied by volume over 1, multiplied by volume over 1. So this is the formula we can comfortably use to calculate the dose of the drug that we just calculated in mils. So whatever answer we have here is going to be in mils, and which will be equivalent or the same with the dose that we just calculated in milligram. Now what is the required strength? Required strength is the amount that we just calculated. That is what has been prescribed or what is required to be administered to that patient. That is for the pediatric patient or for the child we just calculated his body surface area and also dose. So now the required strength is the strength we just calculated. What is required to be administered to that child is what is required is what is 23.5 milligram multiplied by the volume. I will explain that. The volume here is 2. That is 2 mils over stock strength is 80 over 1. Now, how comes about all of these figures? Now, this is the required strength, what we calculated or what has been prescribed to that patient. Now, this 80 simply means or stands for the stock strength. Stock strength is, you can always obtain your stock strength from the ampoule, and it's usually written this way on the ampoule. Now, what this means is this drug, gentamicin, comes as, or is available for the injection, is available as 80 milligrams per 2 mil. So the drug, this is the strength of the drug. It comes as 80 milligrams in a 2 mil volume. So the volume of the drug is what? Is 2 mil. This is not a problem. Why? Because you can always find it on the ampoule, right? It's something that you have in your possession. Let's assume I've never administered gentamicin to a patient before now, and I have a patient that I need to administer gentamicin to, and the dose that I've been prescribed for that patient is 23.5 milligrams. So how do I go about it? I have this, which is the required strength, but I don't have this. So what do I do? All I need to do is get my ampoule, look on the label of the ampoule. You always find something like this. Always, it must be written. You'll find the strength and also the mil. Now, once I have this, just go through the ampoule, you see it. Okay, this is 80 milligram over 2 mil. So that is to say, the required strength, the stock strength rather. The stock strength now will always be on what? On the ampoule. If it's an ampoule, if it's a vial, you always find it in what? In the vial. So it is, since gentamicin comes in an ampoule, you always see the amount, that is stock strength written on it, and also you see the volume written just like this. So that means our stock strength now is 80 milligram and our volume is 2. So this will give us 23.5 will give us about 47 to give us 47 over 80. So 47 over 80 will give us 0.58 0.5875. So this is what is going to give us 0.5875. So approximately we can say that the dose to be administered is 0.59 mil. So now this is what we have. Approximately it gives us 0.59 mils. Now what does this mean? It means that this particular strength or required strength or this particular dose we calculated earlier on is the same as this one. So meaning we have transformed, we have changed, we have converted 23.5 milligram into mil. So this is the same. This is the same. Because this we cannot withdraw this from the syringe, and that's why we have to get the equivalent of this in mils for us to withdraw it comfortably without any issue. So this is the same. 0.59 mil is the same thing as 23.5 milligram. So this is where we are going to draw the cutting for pediatric drug calculations, specifically the aspect that focuses on drug dose. So you can go through my YouTube page to see other several aspects of the drug calculations that we have looked at. But of course, in case of any issue or any further inquiry, you can reach me on my WhatsApp number. Is showing on the board. Then of course, you can also contact me through my email at 2606-9088gambo@gmail.com. So this is my email and of course my phone or WhatsApp number. So you can contact me for further information with regards to what we have calculated so far. And of course, we are open. So I'm also open for partnership with regards to any area you have difficulty, or as a school or as an individual, where my doors are open for collaboration and partnership. Thank you.